So Dr. Jaya Pathak is the Chief Dermatologist and the Medical Director at Potenza Wellness. So thank you again. And today we have a lot of interesting questions that I think most people want to know. So should I just start right away?
Yeah, just start right away so that we get right into it.
Why do women experience more skin issues than men?
So, there's a very simple answer to it. We are just hormonal, and every stage of our and every period of our lives, we have different hormonal fluctuations which show up differently as different skin manifestations. So, during puberty, there are increased androgens. So, all our sebaceous glands, they produce a lot more oil. We go through the whole acne stage. Then we have pregnancy. Again, there's increased estrogen, progesterone that comes with its pigmentations like melasma. We have allergic reactions during pregnancy. Some people are even more prone to acne. Then we have adult onset acne. Menopause, our estrogen regresses. So then our skin gets dry. There's sagging, loose skin. So it's basically our hormones which fluctuate. If we have PCOS, insulin resistance, so there's a whole plethora of things that happen. And unfortunately, it all results in different skin manifestations which aren't the most pleasant. Yeah.
So Jaya, coming back to pregnancy and postpartum, all of us experience pigmentation, there's more acne, there's more sagging. What's the reason for this?
So again, hormones, the increased estrogen, increased progesterone, plus sun exposure, so that triggers pigmentation. So usually for preventative, we try to get them on vitamin C serums, which is a great antioxidant to be on, tranexamic acid, azelaic acid to treat it during pregnancy, because these are still safe during pregnancy. Otherwise, we wait for the pregnancy to finish and then start treating the pigmentation. Acne, again, because of the increased hormones, there's excessive sebum production, so there are clogged pores which get inflamed, lead to acne. Then we also have stretch marks because everything is expanding, and that leads to collagen breakdown, which results in stretch marks. So during the pregnancy, we can only recommend things like centella, oils, rosehip, almond oils to just keep the collagen a little more active so it doesn't become as severe. But again, the treatment is more postpartum than during pregnancy, unfortunately. So yeah, pregnancy comes with its own little skin concerns which we all have to get treated eventually.
That's what they say, right? Men are so lucky. They also have the baby, but women have to go through all of that.
Yeah, unfortunately. But I mean, it is rewarding for a lot.
Yes.
But yeah, I think women have to put in the extra effort because of the hormones, so it's just a combination of things.
Basically.
Yeah, it's the imbalance, it's the increase during pregnancy, it's the regression which happens suddenly postpartum. So balancing everything plus the stress of having the baby, breastfeeding, you don't have time to look after yourself, we forget our sunscreen, so then the sun exposure during that period again isn't fun for pigmentation.
That's a lot, actually. You're right.
Yeah, it is a lot. We don't realize it. We've normalized pregnancy, so we don't realize what it actually comes with. Yeah.
But now coming back to more questions is the pressure we have. Today's women, they have this pressure to always look young. Now, what's the way to also look young and it being non-toxic, like a non-toxic way?
So my one thing I think I tell everyone that comes to me is that these are wants and not needs. Aging is a very natural phenomena which we all undergo, right? And we've seen ourselves age in our 20s, 30s, 40s, so we see the difference. But it is something that is natural. It depends on the effort each one wants to put. So it's more about self-care than reaching a standard which, whether it's social media that has, put out there for all of us. So we don't have to reach a standard. There are no beauty standards. And it's basically guiding people to letting them know what they're ready to do or not do. And there's enough out there for everyone. So I think to age gracefully is more important than to look a certain way. And for that, you have things to keep your collagen young, whether that's microneedling, certain lasers for rejuvenation, things for hydration. There are skin boosters now like exosomes, PDRN, polynucleotides. So there are a lot of non-invasive, minimally invasive ways to go about it, like MNRF, radio frequency, and fillers and Botox again needs to be done in a manner which is subtle, where we are enhancing how you look and not making you look like a different person or a different version of yourself. So if done nicely and in a subtle manner, aging gracefully is possible. And it is self-care. I think it's also more than the pressure, because people are now self-aware and are indulging in self-care. I think this industry is growing, if I can call it an industry.
Yes.
But the medical field is now seeing a lot more people indulge in self-care and are more concerned about the way they look or how they are aging. But yeah, I don't think there is a standard that we all need to live up to or succumb to the pressure of looking a certain way.
Definitely, you know, I see women and they really like they have this, this thing, their faces completely disfigured their faces. So, again, there's a lot of myth in India that because we have darker skin, we don't need sunscreen.
Yeah.
But at the same time, that I know that you've recommended sunscreen to me. So I would like everybody to know what's the right amount that we need to use, and which is a good brand, if you don't mind sharing that.
Yeah, so sunscreen, well, I think is imperative for all of us. So when you look at anti-aging, the sun is one of the biggest factors for aging, the UV damage. We don't realize it, but it causes a lot of superficial fine lines, it causes freckles, pigmentation. So again, it accelerates aging. So if you see a face that has prolonged sun exposure, then those indoors, you can definitely see a difference, right? So sunscreen is important, and now it's as important while we sit indoors, because now we have LED lights which also have UVA, UVB, right? So there is damage indoors too now. So a minimum SPF of 30 is definitely required. If you can get our hands on a 50 SPF, nothing like it. Again, I think most of us are lazy, so we don't put in the effort when we are indoors. But I think once you make it part of your regular skincare regime, it's important to incorporate it. Don't put in a serum, but moisturize and sunscreen. And any good sunscreen only lasts 3 hours. So I usually recommend that you reapply it every 3 hours. So 9 a.m., 12 p.m., 3 p.m. just for convenience. And the amount is usually, we say 2 fingertips, which doesn't mean that you fill up the 2 fingers, but you put a line across and let the tube flow across your 2 fingers, and then dab it all over your face and then even it out. But yeah, so brands, it depends again on different skin types. Mineral sunscreens for Indian skin are great, because now people are more conscious about the chemicals that they're putting. So mineral sunscreens work, but they have a white cast. Acne prone skin, again, gel based sunscreens. Those who want to put in a minimal amount of effort, you get sunscreens with moisturizers or even with vitamin C and hyaluronic acid. So you're getting your actives in, and you're getting sun protection. So it depends on how you want to go about it. So there are multiple brands. There's Isden, Uriage, Babe. So there are multiple brands. Obagi has a good sunscreen. So whatever works for your skin, because it depends on your skin type, whether it's oily, dry. So yeah.
So it's a must. Basically,
it is definitely a must.
So we keep talking about a lot of treatments that we can do.
Correct, yeah.
Today, can you share some desi home nuskas that we can use?
So I'm not a big fan of desi nuskas.
sorry for putting
because we get a lot of people who come in and they're like, my mom made this concoction, they put multani mitti and honey and I've broken out, or so we see a lot of people break out with desi nuskas. That being said, certain things like turmeric is something that a lot of skincare products are coming out with turmeric, because it has its anti-inflammatory properties. Curd, which again has little lactic acid, is great for exfoliation. Honey, again. So we now have all of this in cosmeceuticals, right? incorporated. The problem with the raw material is that they aren't processed, so you don't know who can get allergic. So they're not hypoallergenic, so people do get reactions. But so if something is tried and tested and it works for someone, then I ask them to continue doing it. But I usually ask them to avoid the desi nuskas only because I don't know how the skin will react. So it can sometimes do more harm than good. You know, like how sometimes people put toothpaste on acne because, you know, they feel like that will help. Or, you know, even applying something like lemon on the skin, it can cause burns.
Yes.
So, you know, it's irritating for the skin. So for sensitive skin, people then come out with breakouts or they're red. So we have to put them on anti-allergies, put them on topical steroids just to calm the skin down. So yeah, it has its pros and cons. So for those who are used to the desi nuskas and they feel like it works, great, good for you. Please go ahead if you know it's definitely working. But for most, I've seen a lot of reactions that we end up treating.
So basically, let's not try all the DIYs we see on Instagram.
Yes,
right?
because you know what may work for me will definitely may not
Yes.
work for you. So yeah.
I agree. So do you see all the breakout? It's
It's a desi
DIY,
nuska.
yes.
Oh, damn it.
That's why the question.
Fair. So now there's this rice water, and I don't know, there's a lot that's happening.
A lot.
And
you know,
social media doesn't help, right? So,
it doesn't help. And you know, there are a lot of brands also, like makeup brands.
Correct,
Which
yeah.
say that we are all organic or we
Correct.
don't have any chemicals.
Yeah,
Actually, they're
yeah.
saying that they're chemical free.
Correct.
And you know, since years we've had this thing between makeup and skin.
Correct.
Like it's believed that makeup does spoil your skin. It has some effects on it.
Yeah.
And now with all the new products, so firstly, what do you think about makeup on skin, like the entire day? And also, if these new products that are saying that they're saying are chemical free, are they really chemical free?
So, see, that's a tricky one because the industry is now so vast, and with social media and money behind marketing, you don't know what really goes in. But yes, there are certain brands which are dependable. And I think you realize the ones that are good are the ones that have been around for a while, right? So they've been around for a while because people haven't reacted to it, or it hasn't caused discomfort or acne or comedons. So when a brand is good, they will tend to last longer. So, you know, tried and trusted brands are a safer bet. I'm always skeptical about trying any new products or new makeup. But that being said, you still give them a chance, especially, you know, now you have the vegan or non-comedogenic. So it's important to pick out a few things when you look at makeup. One, it should say non-comedogenic, because those prone to acne or those who aren't even prone to acne, makeup tends to, you know, concealers, foundations tend to block pores, which can lead to acne.
Is that written on all the...
good makeup brands will say non-comedogenic
Is
because
it?
you do have a certification, you have tests for being a non-comedogenic brand. So you will so those who don't will not be non-comedogenic most likely and can cause acne, especially to those who are prone to it.
Oh my God, this is a really great one.
Yeah,
So one must read
One
it.
must read. So, you know,
Yes.
usually silicone-based makeup can be comedogenic. So those are avoidable, especially when you have problematic skin. And so makeup is good, but it's important to clean it out. Because if it's on your face, we are sleeping with it, it does block our pores. We don't know exactly what is in it. So if you're using it for a few hours during the day, great. But then come home, I usually advise most people to take micellar tonic on a cotton pad, clean your face, and then use your face wash. Or, you know, whatever cleansing balms people are used to using or removing their makeup. So use it for a few hours. Makeup is I'm not against makeup. It helps enhance all our features, so why not indulge? But it's good to be safe with the products that you use on your skin, because then dealing with the side effects and acne is, I think, a bigger pain than just using the right makeup for yourself. But again, cleaning it out well and making sure that, again, silicone is a good ingredient to avoid. And just pick out trusted brands. So yeah, that's a safer way to go about it.
Thank you for that. Actually, that's a big learning. It's a big learning to read the backside of each.
So it's important to know, because now I think everyone's aware. They are very aware of ingredients. So I think now everyone reads what's going onto their face. So yeah, why not?
No, of course.
And it's an
of course.
investment. Makeup isn't cheap anymore, right?
No,
so
not
it's
at
an
all.
investment. So if you're investing in something good, you might as well know what's
Know
going on.
what's
to your,
on- in
yeah,
it,
Yeah,
right?
yeah.
Wow. And something that I think a lot of people want to know,
Yeah.
everybody's, living these fast-paced lives and they don't have time. Or
Correct.
if they have time, they're lazy.
Yeah.
So if you can help or, tell us like a 10-minute secret that we
Yeah.
could use for our skin every day. Like something we could do in 10 minutes.
So I do believe less is more. I don't
Oh,
put too
great,
much
great.
because you don't want to keep putting too many actives and continuously sensitizing your skin. So for the short term it may be beneficial, but long term it makes your skin sensitive. Then you're prone to more pigmentation and things like that. But a very simple regime to follow is a gentle cleanser, nothing very harsh. A good antioxidant serum, so vitamin C if it works well for you. If it doesn't, then we switch it up with hyaluronic depending on your skin type. You can get your dermatologist to advise a good serum to start off your day, a good antioxidant which is more protective, then a decent moisturizer and sunscreen. So just a cleansing, a serum, moisturizer, sunscreen during the
Should
day
do
is
it.
great. Bedtime, it can be more treatment oriented. So if you have acne prone skin, a serum for acne. If you have pigmentation, something for treat the pigmentation. If it's for anti-aging, then a serum, retinol base for, again, treating aging concerns. And then always never forget your moisturizer. So that should be your last layer.
So
So
that's
something
that.
for the under eye, yeah. So just keep it simple. 2 things in the morning, 2 things at bedtime. So in the morning it's your serum and your sunscreen. The moisturizer is common. And at night a treatment serum depending on your concern, a moisturizer and under eye if you need it. So yeah, keep it simple.
Perfect. That's easy. That
That's
sounds
easy. It's
actually,
easy. It's
right?
not too much.
Yeah.
And it does the job and helps maintain your skin. So you'll see long-term benefits from it.
Great. Now coming to retinol, actually.
Yeah.
So there have been a lot of myths or doubts. Like, is retinol good for us? Is it bad? Because in some people it causes a lot of irritation.
Correct, yeah.
Some people have started believing that it's thinning their skin layers.
Yeah.
So-
See, a lot of our dermatology textbooks are written by Caucasians, right? So Caucasian skin, if I compare Caucasian skin to Indian skin types, they tend to age a lot more than we
Yes.
do, right? So for them, retinol has a lot more benefits. In Indian skin type, yes, retinol is important for anti-aging. It has its benefits, but we don't need to use it as often. So
That's
even
true.
just incorporating it once or twice a week does the job. And yes, I think and those who have sensitive skin, retinol may never work for you, right? Because it does irritate if you're not hydrating it in the right manner. If you're not using retinol advised by a dermatologist with the right moisturizer, you will tend to irritate your skin. You're not using the right kind of sunscreens, you're not stopping it before treatments, you will continue to irritate your skin and aggravate any condition. So retinol is tricky, but done the right way, used in the right manner, and used maybe once or twice a week will be beneficial. And it does have anti-aging. It's a good product to use, but it needs to be done right.
Perfect.
Yeah.
Thank you. So everything is good if you're
doing it in the right way.
Yeah, if
you have
you're
to
doing it in the right way,
Yeah.
and you need to be advised. You can't just pick up.
Yeah, and there are different sorts of retinol. There are retinoids. So you need to see what works for you and what doesn't.
I
So-
feel in this new era, right? Instagram has really taken over.
Yeah, so social media has become problematic, especially
Yeah.
where skincare is concerned, because there's so much out there.
So much, right?
Yeah.
And I feel there are all these companies that are advertising.
Correct. So there's a lot of marketing.
Yeah.
Yeah.
And I see that in dentistry too, right?
Correct,
So
yeah.
I know, it's like people come up with the funniest and the silliest things, and you're like, really? And they're like, no, we saw it.
Correct.
So I actually tell them that, if you see anything, don't believe it. It has
Correct.
to be coming from the right source.
Which
You're
is
hearing,
yeah, like you've hit the nail on the head right there, because your source needs to be right, because there's so much out there and there's so much of misinformation that you need to pick and choose so you're on the right track and you're not doing more harm than good for yourself.
Good, exactly.
Yeah.
They come up with funny things like, will this cause carcinoma? I know, like
we're
basic
wow.
things, and
Yeah.
I'm like, no, because you know, is that a doctor who suggested all of this?
Correct. Yeah.
So they don't actually know the person who's even, you know,
No,
advocating
recommended.
something.
Yeah. Fair.
So perfect. I
Yeah.
mean, this has been great, and I'm going to
Thank you.
come to. I'm going to come up with a few rapid fires for you.
Sure.
If you could help
Go
us
for
with,
it.
you know, like quick answers, that'll be
Yeah.
great. So, best method for hair removal and why?
The best method is laser hair reduction because waxing, threading has too much trauma. You know, people come with burns which lead to pigmentation. Also, laser hair reduction is permanent, so you don't have it's not something that you're stuck with lifelong doing. And it's not painful now with the kind of lasers that are there out there. And also it treats concerns like strawberry skin, keratosis pilaris and things like that. So hands down laser hair reduction, nothing gets better than that.
Oh, perfect.
Yeah.
And is female pattern baldness, is it treatable?
Yes, it is treatable. But I think what happens is that a lot of people come in when it's reached a higher grade. So when you see signs of hair loss or hair thinning, the earlier you come, the better the result. And again, the only thing is consistency is key, because I keep trying to explain to those who come to me that, you know, this is like diabetes. You have to keep doing something regularly to keep it in check.
Yeah.
So it has to become a part of your regime, but it is treatable. But it depends on when you come in. You know, you can't come with like severe hair loss and be like, do something. Yeah, so then that's tougher to treat. But yeah, when you come during the early stages, it is definitely reversible.
That's like,
and
I
you
think,
can
with
then maintain
all
it.
the medical problems,
correct.
right?
Yeah.
All the diseases.
Yeah, so.
And glutathione, IV or tablets?
IV for better absorption, definitely. But those who are skeptical and they don't want to go down the IV route, then the supplements now are pretty good, because you have liposomal, they're combined with vitamin C, so there is some sort of absorption. Glutathione is a great antioxidant, so it has a lot of antioxidant benefits. So yeah, IV for better bioavailability and absorption, definitely. Yeah.
Great. And what about hair PRP or minoxidil drops?
Again, that depends at which stage you come in. So if it's an early stage and you're able to maintain with just minoxidil, then great. If we feel like, no, we need to intervene and we need to start PRP, again, even when we do PRP, we do recommend minoxidil go side by side. It's not one over the other, usually. So yeah, it has to be a combination. Hair is a very complex keratin, so yeah.
One needs to.
Yeah, so we have to treat it in a manner. So it will always be in combination. Minoxidil is more long-term and a consistent treatment. PRP will give you a couple of sessions. Once you start seeing growth again, it's maintained by minoxidil. So they go hand in hand.
Great. And the last one, again, do toners reduce pores?
So there are a lot of toners out there, right? And initially a lot of them were alcohol based, but I am not a big fan of toners, because what it does is it strips our natural oils, right? And in fact, it leads to open pores. So you feel that nice tight feeling, but that's also because it's dried out your skin and your pores are like now stretching. So very few people are aware that that's what it does. Though now you have non-alcoholic toners, you have toners that are hydrating, so they still come under the bracket of toner. They're not the conventional toners, but so those still are fine, but avoid at least alcohol-based toners that strip your natural oils. We don't want to strip our natural oils. Even for acne-prone skin, we need to hydrate with a moisturizer. So you never want to strip natural oils. It always leads to open pores.
Wow. Perfect. Thank you.
You're most welcome. This was fun.
Yeah, this has been great. In fact, just one more tip for the teens, like a quick one.
For the teens?
Yeah, all the teenage girls out there.
So usually teenage acne is just a phase, so don't fret. But that being said, once you do have acne, it's good to start with gentle treatments and start doing things so that they don't leave marks and scars. Because treating acne is a lot easier than treating your scars and marks. So yeah, just keep your acne in check, and it's just a phase for a couple of years and then you're over it if you do it the right way. So yeah.
Perfect. Thank you so much
You're most
for
welcome. This
this.
was a lot of fun. Thank you for
Yes.
doing this with me.
Of course, and thank you for being a part of our Women's Day special.
Yeah, of
you
course,
know,
this is
and,
like this is a great platform for Women's Day because I think everyone has these questions and they don't know exactly how to go about it. So I don't know how helpful this is, but I hope it
it's
has
been really
helped
great.
in some form or given some clarity at least in certain areas.
I'm
Yeah.
sure it really has. I mean, from reading the covers of each product we're using to even glutathione, everything. I think you've touched almost every topic or every question a woman has.
Yeah.
So thank you.
Of course, it's been an
Thanks for all the
absolute pleasure.
tips.
It's been an absolute pleasure.